Birth control and contraception is a necessary consideration of any intimate relationship. Contrary to popular belief, they are not one and the same. According to Human Sexuality Diversity in Contemporary America, birth control is any means of preventing a birth from taking place, while contraception is the prevention of conception altogether. It is the category of birth control in which the sperm and egg are prevented from uniting. In taking control of our reproductive capabilities, we must be aware about the existing methods of birth control as well as ways to protect ourselves against sexually transmitted infections or STIs. To be fully responsible in using birth control, individuals must know what options they have, how reliable these methods are, and what advantages and disadvantages each has. You can find the following information at PlannedParenthood.com. There are hormonal and barrier methods of birth control: the pill, injectable contraceptive, contraceptive patch, the vaginal ring, and implants are hormonal methods. Oral contraceptives are the most popular form of contraception. They contain synthetic estrogen and/or progesterone that regulates egg production and the menstrual cycle. The hormones in the pill work by keeping eggs from leaving the ovaries. They must be prescribed by a physician. If more than one is missed, the method is no longer reliable and another form of contraception should be used for the rest of the cycle. A year's supply of pills may be free from a public clinic or cost more than $500 at a pharmacy. The combination pill is more than 99.7% effective if used correctly. The typical user rate is 92%. The pill will not prevent against STIs and HIV infection. There are many possible side effects. Those most often reported are spotting, breast tenderness, nausea or vomiting, and weight gain or loss. Other side effects include spotty darkening of the skin, nervousness and dizziness, loss of hair, headaches, changes in appetite, sex drive, and moods. There is the risk of stroke and heart attack. This risk is very low for most women who take low-dose hormonal contraceptives, but that risk rises with age. The benefits of combined oral contraceptives generally far outweigh any significant negative side effects. Pills are easy to take and are very dependable. The injectable contraceptive provides lower doses of hormone and protection from pregnancy for 12 weeks. The progesterone is injected into a muscle or under the skin and is then gradually released into the bloodstream. It has a 99.7% perfect use effective rate, while the typical use rate is slightly less at 97%. It contains no estrogen. Side effects include irregular bleeding and therefore do not appear to cause the potentially serious problems associated with the hormone. It is also known as Depo-Provera and is highly effective for 3 months and causes women to have very light or missed periods. Disadvantages of the injectable contraceptive include menstrual cycle disturbances, unpredictable episodes of bleeding, weight gain, depression, and temporary and reversible decrease in bone density. A woman should get her first injection within 5 days of the start of her menstrual period. The drug is effective immediately. In addition to an examination, which may cost from $35 to $250, each injection costs between $30 and $75. The birth control implant is about the size of a matchstick. It is inserted under the skin of the upper arm and protects against pregnancy for up to 3 years. It is available under the brand name Implanon and requires a doctor to insert and remove it. The cost of the exam, the implant, and the insertion ranges from $400 to $800. The device is highly effective, discreet, does not interrupt sex or require maintenance. It has no estrogen-related side effects and is easily reversible. However, they may cause unpredictable bleeding and weight gain, may have insertion complications, and may increase the risk of blood clots. I've talked about 3 forms of hormonal methods of birth control: the pill, the injectable contraceptive, and the implant. People have used birth control methods for thousands of years. Currently, with so many safe and effective methods available to us, it's important to do research to find the most appropriate form of birth control for your lifestyle. Only you can decide what's best.